Hello, my name is Leah Christie and I'm a student nurse at the University of South Alabama, and today I'm going to be doing an IV checkoff. So now I'm going to have her scan my room. And now I'm going to verify my patient care order form as well as the hospital policy. I'm going to perform hand hygiene upon entering the room and gather all of my equipment. And then I'm going to identify my patient using two identifiers. I'm going to be using the patient care order form and the armband. So I see Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963. I also see that he has an allergy to penicillin, which is also on the armband. And then I'm going to explain the procedure to the patient and provide patient privacy. Then I'm going to position my trash can and perform hand hygiene. And then I'm going to put on my goggles and I'm going to raise the bed to a working height, lower the side rails, and position my patient in the supine or sitting position. Once I do that, then I'm going to open up my kits using sterile technique. And then I'm going to place 3 pieces of tape out. Once I do that, I'm going to take my alcohol swab and I'm going to swab the port without touching the white part. And then I'm going to discard and I'm going to take my water-filled syringe and I'm going to take the cap off, place it in the sharps container, and I'm going to prime my tubing over the trash can to make sure it's working. And then I'm going to apply it to my port. And then once I do that, I'm going to flush my tubing to ensure that it's working. And then I'm going to loosen my port to make it easier for me in the long run. And I'm going to place it back in my kit. And then I'm going to take my, I'm going to pick a vein. So I would pick a vein using 3 indicators of using the distal and the non-dominant arm, as well as finding a large, soft, spongy vein and avoiding bruising. And then I would list the 3 ways that you would infiltrate a venous distension, which would be stroking the vein gently, also applying warmth for vasodilation for a couple minutes, and then making sure that the extremity is in dependent position. And then I'm going to take my tourniquet and I'm going to place it 4 to 5 inches or 4 to 6 inches above my insertion site. I'm going to pull tightly and just do halfway through for easy removal. And now I'm going to palpate my vein and I'm going to check for the radial pulse. Once I check for the radial pulse, I'm going to put on my clean gloves. I'm going to move this, my kits a little closer to me, as well as the Tegaderm and the needle, and then continue putting on my gloves. And then I'm going to take my chlorhexidine and activate it with the wings, and I'm going to clean the injection site vigorously using circular, vertical, and horizontal motions for at least 30 seconds. And then I'm going to discard and let it dry completely. Once I let it dry completely, I'm going to remove my top of my needle, and I'm going to anchor my insertion site 1.5 to 2 inches from the insertion site, and I would tell the patient to remain calm and that they're going to feel a poke, and I'm going to put my angle at 10 to 30 degree angle with the bevel up, and I'm going to insert until I see blood return. Once I see blood return, I'm going to lower the needle and advance it 1/4 of an inch. Once I advance it 1/4 of an inch, I'm going to put the hub all the way up, and then I'm going to release my tourniquet, and I'm going to apply pressure 1/4 of an inch above the insertion site, and I'm going to remove the needle gently and place it in my sharps container. And now I'm going to take my port and I'm going to unscrew it and screw it onto my other port gently. And now I'm going to use a piece of tape to secure the tubing. Now I'm going to take my water-filled syringe and I'm going to aspirate, and then I'm going to flush the tubing. Once I flush the tubing, I'm going to be assessing for any swelling, and then I'm going to remove my water-filled syringe from the port and put it in my sharps container. And now I'm going to take my Tegaderm and I'm going to remove the wrapping, and I'm going to place it over the blue part but not over the green part. And then I'm going to remove the wrapping and I'm going to discard of that, and then I'm going to remove the tape. Once I remove the tape, I'm going to grab a new piece of tape and I'm going to let the tubing loop, and I'm going to place the tape over the loop. And now I'm going to discard of all of my equipment, and I'm going to remove my gloves. And I'm going to move this kit over here. And then I'm going to take my label and I'm going to label the date, time, the gauge of the catheter, as well as my initials, and I'm going to place it on the edge of the dressing, not covering the insertion site. And now I'm going to perform hand hygiene, and I'm going to lower the bed to the lowest setting, raise the side rails, and position the patient comfortably. I would also tell them the signs and symptoms, as well as how to prevent dislodging of the tubing. So the signs and symptoms are infiltration, inflammation, and phlebitis. And then the way to prevent that is to instruct the patient to tell the nurse if they see any bleeding in the tubing or if it slows down or stops, as well as to protect it while moving, and then also to cover it when showering. So after I do that, I'm going to perform hand hygiene, and I'm going to document the time, date, location, how many, the number of attempts needed, as well as the catheter gauge and length, the patient's tolerance, as well as the presence of a saline lock or a flow rate. And then I would also document the method of infusion if a fluid was prescribed. And then I'm going to come back, and then I'm going to wash my hands, and I'm going to put on my second pair of clean gloves, and I already have my goggles on, and then I'm going to reposition the patient to where they need to be at the working height, and I'm going to remove the Tegaderm, and I'm going to assess for any stuff, and then I'm going to discard of the dressing, and I'm going to remove the tape, and then I'm going to take the gauze, and I'm going to apply pressure for 30 seconds while removing the catheter gently. And then I'm going to check the intactness of the catheter, and then I'm going to place it in the sharps container, and I'm going to leave my pressure for 30 seconds, and then I'm going to apply another piece of tape to secure the gauze, and then I'm going to look for any tenderness or pain, as well as bleeding and any swelling or inflammation, and then I would document. And that is all. Thank you.